Hello, everyone. My name is Miss Tenora, and today we are going to review our new tray of the week, which is root canal therapy treatment. Um, as I said before in the introduction, you can utilize chapter 24 in your green hard textbook on page 564. It pretty much explains to you what the endo treatment is, the root canal treatment is, and the functions of each instrument. Okay, if you start on page 570 all the way to through the end of the chapter, it will definitely tell you what each instrument is and the function. But I'm going to give a brief rundown on each instrument, okay? So let me go ahead and share my screen. Alrighty, you guys, this is the actual tray. Okay. This states the order that we would actually go into for the procedure. Now, your orders between whatever doctor you're working on, it could change from the order that I'm giving you because it's totally up to them what they use first. But here is what we're going to start off with. Okay. So I've already pretty much went through the basic instrument tray. So my focus is not so much on that, but we will do a brief rundown on it. Okay. Let me zoom in. All righty. And I'm going to zoom in just a little bit more. All right. So as you know, all procedures, your patients come in, we have to have a basic setup. That's your mouth mirror, your explorer, treatment pliers, cotton rolls, saliva ejector, HVE, and air water syringe tip. We need those things, okay? If you are still unsure about the possible basic instrument tray, you can go back to our basic instrument setup tray and get into that. And if you have any questions in reference to that, please paste them in the comment box and we can definitely do a refresher on that. All right. Now let's move on. Being that we are definitely doing a treatment that is inside of the patient's mouth and requires us to poke around and drill on certain teeth, we have to numb the patient, of course. So you want to take your 2x2 gauze, dry the tissue. You want to take your cotton tip applicator and apply that topical in the area of where we're actually working on. Let that topical numb that area before we place the injection in that area. So you want to let it sit for about a minute. Once that is done, your doctor's going to come in. You are going to give the doctor the syringe. Now, remember, as an assistant, you want to hand the instrument to the doctor from the working in. What that means is, so you see on the syringe right here, you have this first little part where you would put your thumb in, okay? And then you have the handle part. So you would say your thumb placer here and this part right here, that would be the handle where you would actually grip the syringe, okay? So you want to hand it from this, from this into the actual doctor, okay? Your best bet is to hold the syringe around right in this area between your two, and I have the syringe right here, between your two fingers right here. So you want to hand it to the doctor from the working in. That way, if you hand it to the working in, the doctor can easily place it in their hands, okay, the way they need to, and go ahead and give this injection to the patient. Now, you always want to do that behind the patient's head, okay? Behind it, never in front of their face. The needle could freak out the patient, okay? We don't want them to jump, freak out, and be more nervous than they already are. So you want to hand to the doctor just like this. That way they can grab the syringe and go ahead and numb the patient. Okay, now to recap to recap that particular needle. As you can see, it's a needle. You never want to take the needle and try to recap it like that, because you can easily stick yourself after sticking a patient. You never want that to happen. So with that being said, you want to go ahead and use the recapping device. Now, if you look here, here's your recapping device. All right. It's a little upside down, but it's okay. It's just like this one. Okay. So what happens is that your cap should already be inside of the recapping device. Okay. And as you can see on here, it says one-handed. So you should be able to recap your syringe with one hand. All right. So with that being said, you are putting the syringe inside, right? But you are not you can't necessarily stick yourself. So what you would do is, this would be sitting on the counter. You would take the needle, place it inside of the cap, and that way you have recapped that syringe without sticking yourself, okay? And it's pretty easy, just like that. If you have any questions on that part, you want to definitely leave that question in the comment box, and I will get back with you on any questions. Okay. So hopefully that was a breakdown on how to recap. Hopefully you understood that breakdown. All right, moving on. Anytime we're going to do a root canal treatment, you want to definitely be able to isolate the patient's mouth. Okay. Isolating the patient's mouth. One, if the patient is having issues keeping their mouth open and closed, you want to use a bite block. The doctor may call it a mouth prop, but you're going to take the bite block and you're going to place it inside of the patient's mouth on whatever side you're not working on. So if you're cutting on this side, you want the patient to bite on that side. If you're cutting on this side, and I say cutting meaning working, opening up the canals, you want to put it on the opposite side, okay? Your patient is going to actually bite down here. And there's these little rigid lines where your patient will bite down. And this allows them to be able to bite down without biting all the way down. It kind of gives them some stability to stay open. You never want them to open during that procedure, okay? Now, this particular next instrument, it is called the rubber dam napkin. What happens is we have to isolate the tooth, okay? When I say isolate, meaning that we want to, one, make sure when we're using that rubber dam that the purpose of the rubber dam is to prevent any type of bacteria that would possibly go inside of the patient's mouth, okay? So if you turn to, let's see, page, it starts the procedure off on page 577, okay? Now, to place that rubber dam, it starts talking about that on page 578, okay? So make sure, I want you to take some time to go through 578 all the way. It goes into the isolation area on 578. So you want to be able to place that dental dam to isolate the tooth while we're actually doing the root canal treatment. So basically, the isolation of the tooth, it says that the dental dam actually improves the visibility for you and the doctor to see and protects the patients from the saliva or any solutions that we are actually putting inside of that tooth. Okay, the dental dam can also pretty much protect the patient's mouth and throat from when we're using all these tiny, tiny different little instruments that we're going to be placing inside of the patient's mouth. Okay. So one, we are going to use this dental dam napkin because sometimes when we put that dental dam on the face, if the patient is nervous, sweating, it kind of gets wet in that area. So you want to go ahead and protect your patients by placing that rubber dam just like this on the patient's mouth. Okay. All right. So once we have that, you are going to then place the rubber dam. Okay. So in order to know exactly where you're going to place that rubber dam, I want you to look at this rubber dam, and I'm just going to draw a brief little I want to give you an idea of what exactly what holes you're punching in and where. So anytime you look at your dental dam, you want to divide it like this in 4. All right. So we have it divided into 4 little squares. Okay. This part at the top replicates the maxillary arch. Let me take that. I don't like the triangle thing. All right. So I'm going to draw the maxillary arch. So here's your maxillary arch. Here's your mandibular arch. And it represents the patient's mouth. Okay. So we just remember that this is the max. And this is the man. All right. So you have 1 through 8 here, 9 through 16, 17 to 24, and 25 to 32. So if you are working on any of the teeth here, you would punch a hole right here in that first quad. In your second quad, if you're working on any of the teeth, you're going to punch that hole along that quad. Quad 3 along this quad, and 4, same thing. Okay, so that tells you sort of where you're going to punch a hole. So for example, if we were working on a tooth in quad 2, as you can see, there's a hole that is punched in quad 2. And you're gonna, if you watch the video from last week, you're gonna see, your reasons why we actually place the rubber dam on the actual tooth. Okay, so once you get that rubber dam placed on that tooth, you are going to come with the actual frame, and I'm going to clear all the drawings. You're going to come with the frame, and the frame is pretty much placed here to actually pull it from the patient's face. Okay, it's going to pull it from the patient's face. Then once you have the frame positioned properly, you are going to place the clamp. Your clamp is actually right here. Your clamp is right here. I'm going to zoom in it a little bit to kind of give you a good idea of what that clamp looks like. All right, I'm going to zoom in some more. As you can see here, here's the clamp that is placed on the tooth. So it's placed here on the tooth, and as you can see, I have some floss tied to the clamp. Sometimes the clamp could pop off. If it does pop off inside of the patient's mouth, and just for safety precautions, you want to have a piece of floss to be able to tie to that clamp, just in case it would fall inside the patient's mouth. You can easily grab that string. You always want to have the string hanging out the patient's mouth. So it's safety precautions so that your patient does not swallow that clamp. Now, you can't put the clamp on without using this rubber dam forceps. So you clamp, and I'm going to show you exactly right here. All right. So here's your clamp right here with the floss. You are going to place the clamp on this forceps. Let me hold it so it cannot unclamp. Okay, here and right, hold on. Here we go. So I have the clamp on, and if you can see that if you need to widen it, it stretches out the clamp. So you're going to place this clamp on the actual tooth. So it's going to be sitting on the tooth like this, holding that rubber dam in place. All right. Once you get it in place, you are going to remove that clamp. And how do you remove it? You want to slide this little button here, untighten it, and it should clamp on the tooth like that. All right. Now, to place that rubber dam, as I said before, I'm just going to show you. Let's say I was in quad 4 working on tooth 19. So you want to kind of come in and clamp it, and it will definitely stretch that hole to fit the tooth in. Okay. If you look at the hole puncher, there is different sizes that you can choose from right here. And this little point clamps inside of that rubber dam, and it gives you the hole. All right. So let me zoom out a little bit. All right. So today's focus in on that actual tray. Let me just go ahead and kind of separate. All right. So today we only focused on this particular part of the actual tray. This thing is so weird, but I want you to study this part of the tray. All right. So remember, we have, I'm going to kind of type for you guys. So text here. This is basic. All right. Basic. This part right here, this is where we are going to pretty much, let's see. This is what we are going to say. This part right here replicates from here to here. This is what we're going to use to actually numb the patient. Okay. So let's just say that this is our numbing process. And if you look on page 578, 578 actually shows you the setup of the tray. Okay. So this is where we are going to say from the 2x2 gauze to the actual cotton tip forceps, I'm sorry, and the actual syringe and the recapping device. We are going to say that this is what we will, this is the order of what we use to numb the patient. So we dry, apply topical, then we give the injection in the works on the work site, and we recap, put that cap back on with the recapping device. Okay. Once we're done with that, we are going to use the mouth prop to help prop that patient's mouth open. Now, remember, the mouth prop goes on the opposite side of wherever the work site is located. Once we have that properly secured, then we are going to get into the rubber dam. Okay, so first thing is first, with the rubber dam, you want to make sure that one, you know what tooth you are working on so that you know where to place the rubber dam. So first thing is first, you want to go to your rubber dam and pretty much see where the tooth is at so you can properly pl- place the use the punch hole and punch a hole on whatever quad, 1, 2, 3, or 4, whichever tooth we're working in. Okay, once you have that hole placed, you are going to place the dental dam napkin on the patient's face, and then you are going to place the rubber dam, put it on top of the tooth. So the rubber dam, find that tooth, place it on the tooth, and then we're going to place the frame. The frame itself, let me just show you really quick. As you can see in the pictures in the book, you can see all the different, you can see exactly how the frame looks on the patient's face. Okay, so, but I'm just going to show you. So you have the little frame, it's going to clamp on like that. And then wherever the tooth is, it's just going to kind of stretch it from sitting directly and smothering the patient's face and the nose, covering the nose. So you're going to place the frame. Then you are going to use the clamp. Here's your rubber dam clamp and your clamp with the floss. You're going to use the rubber dam clamp to place the clamp on the tooth. Okay, so that is the first part of the tray. I want you guys to focus on these particular order of the tray, and tomorrow we will move on to the second part of the procedure. So we just focus on basic, numbing the patient, propping the patient's mouth properly, and placing the actual rubber dam, isolating the tooth. Okay, so I am going to stop sharing my screen. If you guys have any questions in references to this very first part of the root canal tray, please place any questions or comments inside of the comment box. Thank you, and I will talk to you guys soon. So remember, always be great. Okay, bye.